Namaste. Let's look at the internal nasal valve. This is the diagram of the nose. At the nostrils, we have the external nasal valve. This is the upper lateral cartilage and this is the lower lateral cartilage. At this position, if we cut a slice and see the cross section, we will see this diagram. This is where the internal nasal valve is located. Let's look at the boundaries. This is the medial side and this is the lateral side. Medially, it is bounded by the septum. Laterally, we have the lower border of upper lateral cartilage, and here we have the inferior turbinate. These are the boundaries of the internal nasal valve. It has an angle of 10 to 15 degree. Let's move forward and look at the significance. The main function is providing resistance to airflow. During inspiration, what occurs is that the air slows down. Due to this, the exposure time with the nasal mucosa increases, and ultimately, temperature regulation occurs. And also, humidification of air occurs. During expiration, it produces reverse currents. These reverse currents are known as eddy currents. Eddy currents are important because they ventilate the sinuses. What are sinuses? Sinuses are the lateral outpouchings which open into the nasal cavity. Let's look at some causes of internal nasal valve narrowing. First cause is DNS, that is deviated nasal septum. The second cause is turbinate hypertrophy. We have seen that the inferior turbinate forms the lateral wall. Therefore, if the turbinate hypertrophies, it is going to block the internal nasal valve area. Trauma. It can also occur due to aging. Let's perform the Cottle's test. Place your index and the middle finger on your cheek like this. And what you have to do is pull these two fingers upwards and laterally. This test is used to understand or determine the patency of the internal nasal valve. We say that the test is positive if there is a relief from the nasal obstruction. The importance is that if the test is positive, then we can provide surgical treatment to the patient and it will be helpful. All the people who performed this test wouldn't have found any significant outcome because you don't have an obstruction, okay? That's all, and keep watching the nose related videos. Thank you.